everyone. My name is Sarah Adomah. I'm the lead breast clinical nurse specialist at the Royal Marsden Hospital in Chelsea.
Sarah, we've worked together for years. I mean, you have been one of our biggest champions and supporters from the minute. I don't even think Black Women Rising was a charity. It wasn't. It was just me advocating on my own. And I wasn't on my own because I had people like yourself and our lovely Della, R.I.P. And it was just you. We were a small bunch, weren't we, at the time? And that was, oh my God, it's like 7 years ago.
It was, yes.
It was about 7 years ago.
Peckham.
Yeah, Peckham, 7 years ago, Lord. And in this time, we have been able to do some fantastic things together. Yes. So firstly, just thank you for all that you've done for us as well, and just championing us, because that's been such a massive thing for us in terms of where we are now as a charity is the people that are around us and champion our work. So thank you for that.
Thank you. I think it goes both ways, but thank you, because I think the work that you have done has also really given us the impetus to actually bring some things to light and really spotlight the needs that Black women have when it comes to breast cancer and cancer treatment generally. So thank you.
No, thank you. And obviously, through our Black Women Rising survey that we done, so for those that don't know, we conducted our own research. It was a £600 survey. We asked a few questions to our membership at the time. It was just to 100 women, because we didn't have much more members than that. And we were able to produce this incredible small piece of research called the 100 Women Survey. And there was about 10 findings on there that were quite profound. And actually, we didn't know if it was going to produce anything, did we, at the time? We just didn't know. And people kept saying, it probably won't produce anything. It's quite a long-winded project. And I was like, no, let's see what it does. And it pulled out some huge findings. And one of the findings on that survey allowed you to create we have to say, a pivotal, a monumental project that now has changed the course for us in how we go forward with the softies and prosthetics. So do you want to give a little bit of explanation about that?
Yeah, I couldn't agree more. So obviously, been a breast care nurse for a number of years, 13 years in total now, and observed that we had a softie that we give to all patients. So the whole idea is that no woman should walk into the hospital, have their breast removed, and walk out without looking like a woman. So they should be even symmetrical on the chest, so that in clothing, they look just like they walked in. And we had been giving people just one of two colors, which is often called a flesh skin tone, a pinky or a beigey type of skin tone. And this is what we had done all this while. But we knew it was not right, because I've had people tell me that, when you have your breast removed, there's no black implants, there's no black prosthesis for you. But we didn't know where to go to get this changed. No. And I think it was just when you have people that align with you and you have the same vision and drive and, capability to change something, it makes things happen. Because it was just by that same chance that Natalie Johnson came to work at the Royal Marsden. Yeah. We started talking amongst ourselves about the fact that the care we were giving to patients wasn't appropriate. Yeah. And we had a pivotal time where one of our patients got so angry with us, so visibly upset, that we were both in clinic and we thought, this can't be right. We can't carry on like this. We have to change. So we started looking around to find some money, something to change it. But like you said, often it's hard to change things within the NHS because you need data. Yeah. You need some numbers to show somebody that you need money to do something. We didn't have that data. But thankfully, the 100 Women Survey was reported and we went, bang, we got some data. Yeah. You cannot run away from this. So we took that data to the charity and we asked for some money. And lo and behold, they were gobsmacked. Everybody on the panel was like, what? You're giving women, Black women, a pink prosthesis? And we're like, yes, that's what we've been doing. And with that, we were able to partner with Nubian Skin. And in 2022, we were able to launch 4 bespoke skin tone softies that any woman of color having a mastectomy can be given. it's really about giving people dignity. Giving people what they really deserve, and it's not good giving somebody something that they cannot even look at. And it's hard enough going through a mastectomy, having a part of your body taken away, lost to cancer, and not be given something that looks anything closer to your skin. So we were able to use that data to get this softie in. And as I said, it's been pivotal.
Yeah.
It's been life-changing, actually, to the point where we've won 2 national awards this year.
Yes!
Because of that.
And it's crazy because this has also gone international.
Yes.
You travelled to where? Because you went to Belgium. I think that
We went to Belgium.
You
We went to
did,
the European Cancer Summit.
Yeah.
To present this.
Yeah.
We're still looking to get into the international space a bit more.
Yeah.
But we do need to sort of keep working on it to get it out there because as we found out, it was the first in the UK and it's the first in the world. So
it's the first in the world. Else. Yeah, it's the first in the world, definitely. And everywhere I go, people ask about the project, and I just think what you've done is absolutely incredible. And again, it's like these initiatives that are having to be created by black women. Black women are standing up and going, actually, this isn't right. And then they're coming forward to put, do you know what I mean? But it ultimately shouldn't be our job because these things should already be in place. Let's talk about the human experience. Like you touched on it briefly, but I mean, I know what it's like when we get women through the doors, but what types of women are you seeing coming in your clinic? What's the reaction from these women, like when they're seeing that these softies, which were never before in their colour, you may say, for example, it could be somebody that's been, a survivor for many years and they now can come in and get something in their colour. What is the reaction from everybody that you're seeing?
It's been unbelievable.
I bet.
And often
it's been tears, isn't it?
Always makes me cry. And every time I start talking about it, I kind of tear up again.
Yeah,
because
it's
to
a lot.
See the reaction from people, people feeling that they're being treated like a human being.
I know.
It's that humanity that really humbles me.
Yeah.
And what has also been quite immensely touching is the fact that this hasn't even just helped people with breast cancer, even though, yes, me and Natalie work in breast cancer space. We actually had people who have had other cancers, who have had chest wall surgery and need prosthesis, benefited from it. So it's gone beyond the breast cancer space.
It has.
And people to be able to get fitted. And I saw one of our ladies who said for the first time she was fitted with a prosthesis, she was able to wear clothing that were fitting to her body size. And her daughters took her out for a birthday dinner. And, for the first time, that is so empowering. That is so humbling to see somebody, which is what you want, because these people, people are hiding in their bodies and doesn't feel confident enough, doesn't feel that they can love their bodies enough. And to be able to give somebody something like a prosthesis that will give that person that feeling that actually I am still me, I can be me again, and be able to get out and get into social settings and be able to leave. We've been talking earlier on about leaving, just being able to leave the day-to-day life like everybody else is really something that I think for me, I'm just so touched that I've been able to help bridge that little bit of gap.
You should be very proud. You should be very proud.
And be able to offer people who look like me something that is worthy.
Yeah, 100%. And I'd just like to say, like, that part, what you just said there, the human experience. Because I think often the word I've come back, let's just come back repeatedly again, like in the last couple of months, the theme has been women coming forward saying, I don't feel like I'm being treated like a human. It's that human experience. So this is something, again, that is so important to us and black women. So thank you. I think my last question to you is, like, how do you see the future of this project? Because I know it's not been plain sailing. Not for one bit. It never is.
No.
It never is. What do you see the future of this project wanting to go? What can we do to elevate this project as well and make sure that this is in everyone's radar?
Yeah. I think it was very important for us, the team that worked on this project, right from the word go, that it wasn't a project that was going to sit at one particular hospital trust. And we both feel that the trust where we worked this project out was a fertile ground, where we had people who were very much engaging with us, because once we presented this to the panel, we had all the support. Every hands were on deck. And we were able to pull this whole thing together within literally 6-7 months, which is unheard of.
It's unheard of.
But it was because we had that support. It was a fertile ground to be able to bring this out. What we now need to work, and we didn't want it to be made special that you have to come to this trust alone to be able to access this important support, because there are women, Black women, you know, going through breast cancer as we speak.
I know.
And along the length and breadth of the country. And so we need it to be part and parcel of basic care.
Basic
it should
need.
Be part of care and off. You know, there shouldn't be any kind of special request or a special service.
Why is it like that? Yeah, we have to put in a special request.
Yes. It needs to be part of
the care.
What we did was diversify the support. And it should be embedded in every care unit. Everywhere where women are being treated for breast cancer, mastectomy should have this resource to give to women. And it's not just Black women. It covers, we have 4 bespoke skin tones. So you can give it to lots and lots of different women who will benefit from it. So that's what we want to, and that's what we are working on. And I think that's where every platform, every opportunity to talk about it, to engage with healthcare providers, to engage with all stakeholders is absolutely important to me. And I actually will go to every end.
I know you
to
will.
Make sure that every woman who walks through a care center to have a treatment is able to access this.
Okay. Sarah, we love you. Thank you for all you do. Thank you.